Hello everyone, welcome to the part 2 of the two-part video series where in the first part we took up everything from scanning to designing to 3D printing a surgical guide, and in this part we will take up the actual surgical procedure executing what we designed and planned to give you a feel of what it's like to experience the whole workflow of guided implant surgery. As you saw in the part 1, we planned an immediate extraction and implant placement. If you have missed the part 1 of the video, the link to the same will be provided in the description below. Feel free to go through the part 1 to get a proper context of what we are trying to execute. So let's get started. So the first step after anesthetizing is an atraumatic extraction. To facilitate that, we shall start our extraction with a periotome. Periotomes are dental instruments used to cut periodontal ligaments for atraumatic extractions and dental implant placements. They have thin sharp blades to facilitate the removal of teeth with minimal damage to the surrounding alveolar bone. As you can see on the screen, we try to insert the periotome between the tooth and the alveolar bone and gently slide it deeper and deeper, severing the periodontal ligament fibers. It is a time-consuming process, but it's definitely worth it. Make sure not to insert the periotome a lot into the buccal part so that you don't end up damaging the buccal cortical plate. Once done, we can move on to an elevator to gently luxate the tooth out of the socket. The next step after extraction is to thoroughly curate the socket to remove any residual granulation tissue. Once done, we can then move on to irrigating with a betadine saline solution. You can do this multiple times before proceeding and getting the socket ready for an implant placement. Now that the socket is ready to receive an implant, the sterile surgical guide is checked for its fit into the patient's mouth. Once everything is okay, we can start with our osteotomy. In this case, we are using a Dentium Fully guided surgical kit. So the first drill that we would use over here is a 6 mm pilot drill. Since it's an extraction socket, it is almost not going to engage any bone. So we can directly move on to a 12 mm pilot drill since we have planned a 4.5 by 12 mm implant which we saw in our previous video. After 12 mm long pilot drill, we then move on to 3.6 mm by 12 mm osteotomy drill. At this stage, you can reduce the speed to compensate for the lack of irrigation that happens while using a surgical guide. So after your 3.6 by 12 mm, then you can move on to 4 by 12 mm. So the key over here is that you have to make sure that the osteotomy drill completely flattens out with the top of the surgical guide sleeve that is provided by the company and which is there inside the 3D printed surgical guide. So if that doesn't flatten out, then your drill is not going to prepare the osteotomy to the desired length. So after your 4 mm by 12 mm, we then move on to a 4.5 by 12 mm drill. All these osteotomy drills, the 3.6, 4 and 4.5 are done at a very low speed. In this case, we are using 160 RPM with 40% of irrigation. So as you see how easy it is to actually do the osteotomy without worrying about the angle or the stability. Once you're done with the osteotomy, you can now irrigate the socket once before you take it up for implant placement. So we get the surgical guide back in its place and then start with the implant placement. So you take the implant on a motor driver or a motorized implant driver. Secure the implant carefully on the driver and then take it to the surgical site. The surgical guide stays in its position and the implant is now placed through the guide sleeve or the metal guide sleeve that is there as a part of the surgical guide. So as you see that the entire implant placement also would be fully guided and there won't be any deviation in the angle of the implant placement. A lot of times when you're doing an immediate extraction case, the implant generally takes the path of least resistance, which follows the socket lining. So this makes sure that the implant goes in our desired position. Once you have reached a minimum torque that you had set on your physio, you remove the motor driver and you go in with a hand ratchet. The driver that is used with the hand ratchet also has a guiding cylinder so that you can complete your implant placement fully guided. So as you can see on the screen, we have now secured the driver in and we start torquing the implant using the wrench. So once you feel that the implant has reached more than desired torque, as you can see right now that it is almost touching 70 Newton centimeter torque on the hand wrench. At this point you can reverse the direction and you can unscrew 1 or 2 quarter turns, and then you can again make it clockwise and then go in 2 or 3 clockwise turns in, and you can keep repeating the same process so that you can relieve the stresses on the bone from time to time. So when you unscrew it, you can wait for a few seconds before you go in again. So if you unscrew or you go anti-clockwise 1 quarter turn, then you can go clockwise 2 quarter turns, and so on and so forth. Once the drill flattens out on the guide sleeve, then you can remove the hand wrench, and if the implant has achieved very good torque, sometimes it's very difficult to release the driver from the hand wrench. So you can use the back of your mouth mirror to gently tap on it so that it releases from the implant, and you can remove the surgical guide, irrigate the area again and put a cover screw or healing abutment as per your plan. In this case, we decided to go ahead with a cover screw as we wanted to submerge the implant completely into the socket and let it heal with time. So what you can see on the screen right now is an immediate post-op. You can appreciate the perfect placement of the implant, not only in the buccolingual but also in the mesiodistal direction. Here you can see the IOPA of the implant in its final position. You can see how beautifully it goes and kisses the base of the sinus floor, just as we had planned in or during our surgical guide planning. In the next window, we will try and compare this position with what we had planned, in the software, to try and appreciate the kind of predictability that you can achieve on regular basis with or even with immediate extraction cases. Just for comparison, this is a small glimpse from the software for us to appreciate the kind of predictability that we have achieved in the final execution. You can see how well the implant goes and touches the base, and exactly the same result we have achieved in our final surgery. This is a 3-day post-operative picture. You can see the implant and the soft tissue are healing well, and this is the 15 days post-operative view, which shows almost complete coverage of the soft tissue over the implant, and everything looks good. If you found this video helpful, please share it with someone who might benefit from it and leave a small like. We would really appreciate it. Please subscribe to our channel as we intend to make many more informational videos like these in future. So stay tuned and thank you for sticking around. See you in the next one.